Welcome back, audit enthusiasts. Today, we're embarking on a journey to explore the intricate process of conducting internal audits in healthcare organizations. Internal audits in healthcare are vital for ensuring patient safety, regulatory compliance, and organizational effectiveness. Let's delve into the detailed steps involved and key considerations for success, aligned with relevant internal audit standards. Step number 1. Planning phase. As the internal auditor, you must develop and document a plan for each engagement, including the engagement's objective, scope, timing, and resource allocations. The plan must consider the organization's strategies, objectives, and risks relevant to the engagement. Number 1. Define audit objectives. The first task is to clearly define the audit objectives. These objectives should align with regulatory requirements, organizational goals, and industry best practices. Example: your audit objective might focus on assessing compliance with the Health Insurance Portability and Accountability Act, HIPAA, privacy rules, ensuring accurate billing practices, or evaluating infection control protocols. The objectives must also be specific, measurable, achievable, relevant, and time-bound, SMART, as per IPPF Standard 2210, Engagement Objective. Number 2. Scope definition. Following IPPF Standard 2220, Engagement Scope, determine the scope of the audit based on risk assessment and organizational priorities. The scope may encompass various departments and processes within the healthcare organization. Example: consider auditing areas such as patient admissions, medical records management, medication dispensing, laboratory procedures, and emergency response protocols. Number 3. Resource allocation. Allocate resources such as audit team members, audit tools, access to relevant data systems, and documentation templates. Example: assemble a multidisciplinary audit team including clinical experts, IT specialists, compliance officers, and administrative staff to ensure comprehensive coverage as per IPPF Standard 2230 Engagement Resource Allocation. Step number 2. Risk assessment. Internal audit activities must evaluate risk exposures relating to the organization's governance, operations, and information systems. Your risk assessment will include: Number 1. Risk identification. Adhering to IPPF Standard 2120, Risk Management, conduct a thorough risk assessment to identify potential risks and vulnerabilities that could impact patient care, data security, regulatory compliance, and financial integrity. Example: risks may include medication errors, unauthorized access to patient records, non-compliance with medical protocols, cybersecurity threats, and revenue cycle inefficiencies. Number 2. Risk analysis. Apply risk analysis methodologies such as COSO's Enterprise Risk Management Framework or ISO 31000 to prioritize identified risks based on their severity, likelihood of occurrence, and potential impact on patient safety and organizational performance. Example: prioritize high-risk areas such as surgical procedures, medication management, patient data security, and billing accuracy. Step number 3. Audit execution. Internal auditors must identify, analyze, evaluate, and document sufficient information to achieve the engagement's objective. To achieve these, internal auditors must: Number 1. Develop audit procedures. Develop audit procedures and checklists in line with IPPF Standard 2240, Engagement Work Program to ensure thorough coverage of audit objectives, risks, and scope of your audit. Example: audit procedures may include reviewing patient charts for completeness and accuracy, observing clinical workflows, interviewing staff members, and testing IT security controls. Number 2. Gathering evidence. Following IPPF Standard 2300, performing the engagement, gather sufficient, reliable, and relevant evidence through methods such as document reviews, direct observations, interviews with healthcare professionals, and data analytics. Example: utilize audit software to analyze electronic health records, EHRs, financial data, incident reports, and quality metrics to support your audit findings. Number 3. Testing controls. Evaluate the internal controls to assess their design, effectiveness, and efficiency in mitigating risks in relation to patient care, data integrity, regulatory compliance, and operational processes as per IPPF Standard 2130, Control. Example: test controls such as access controls to sensitive information, authentication procedures for electronic prescriptions, and adherence to clinical guidelines. Step number 4. Data analysis and findings. Internal auditors must document sufficient, reliable, relevant, and useful information to support the engagement results and conclusions. This includes: Number 1. Data analysis. Utilize data analysis techniques to identify trends, patterns, outliers, and areas for improvement within the healthcare organization guided by IPPF Standard 2320, Analysis and Evaluation. Example, analyze trends in medication errors, patient readmissions, infection rates, billing discrepancies, and compliance deviations to pinpoint root causes. Number 2. Documenting findings. Guided by IPPF 2330, documenting information, document the audit findings clearly, categorizing them based on severity and impact, and provide objective assessments supported by sufficient evidence. Example, identify findings such as incomplete patient documentation, deviations from standard protocols, cybersecurity vulnerabilities, and coding errors. Step number 5. Reporting and communication. The internal auditor must communicate the results of the engagement as per IPPF Standard 2400, communicating results. In ensuring effective communication, the internal auditor will: Number 1. Prepare audit report. Prepare a comprehensive audit report that includes an executive summary, detailed findings, recommendations, action plans, and timelines for implementation. Example, include visual aids such as charts, graphs, and comparative analysis to enhance the clarity and impact of your audit report. Number 2. Communication with stakeholders. Communicate audit results effectively to stakeholders including healthcare management, clinical teams, compliance officers, and external auditors. Example, engage in collaborative discussions to prioritize corrective actions, allocate resources for improvements, and monitor progress towards compliance and quality goals. Step number 6. Follow-up and monitoring. The internal auditor must establish and maintain a system to monitor the disposition of results communicated to management. In doing so, the internal auditor will check: Number 1. Implementation of recommendations. Monitor the implementation of audit recommendations and corrective actions to ensure they are effectively addressing identified issues. Example, follow up on training initiatives, policy updates, system enhancements, and process improvements to mitigate risks and enhance organizational performance. Number 2. Follow-up audits. Schedule follow-up audits periodically to assess the sustained effectiveness of implemented changes, track progress, and identify emerging risks. Example, use follow-up audits as opportunities for continuous learning, refinement of audit processes, and alignment with evolving regulatory requirements. As an internal auditor in the healthcare industry, mastering these steps and best practices will not only enhance your audit skills but also contribute significantly to improving patient outcomes, regulatory compliance, and organizational resilience. Embracing a culture of continuous improvement, learning, and collaboration will also drive positive change and excellence in healthcare delivery. Thank you for exploring healthcare internal audits with us. Stay curious, stay diligent, and continue to excel in your audit journey. Until next time, prioritize patient safety and audit excellence.